So this is the case of NS3 cataract after limbs, and here I am doing my first side port, and here I go with my second side port. It's not a very well dilated case. The iris is also not very healthy, mid dilated, maybe a floppy iris case, because the patient had history of retention of urine. So definitely it's a floppy case. So I'm giving treatment blue dye to stain the anterior chamber. Now I'll wash it out, and usually such cases when there is floppy iris with the flow of the fluidics of our Phaco, it becomes sometimes very cumbersome to deal with the iris, because they'll try to come towards the Phaco tip and try to get stuck with the tip like that. Many challenges come. So let us see how this case will proceed. I am doing the rexis, and usually the rexis is made 5 mm size in case of Phaco. And here actually I am going little below the iris to make the rexis, so that I have adequate side of the rexis, because if the rexis becomes smaller, it becomes cumbersome to do further steps, and if it is larger, then it becomes difficult, because the pieces will slip out of the capsular bag. So I just ran my cystosome just beneath the rexis iris margin to have a adequate size of rexis. There are some focal areas of cynic as well, I can see here. There is capsulo-lenticular, capsulo-iris adhesions are there. See, the iris is so flappy, it is just swinging inside the eye. Even if I did a very fine and minute hydro, the iris started wavering. Trying to rotate it down. Program 2 अच्छी मारा ए मौसा आखि मिटमिट करंतु नहीं, हलांतु नहीं. So I'll proceed with my Phaco now. Using only hardly 5% of the energy, I'll just try to aspirate out the superficial cortex. I made a small groove. Now I'm just going inside the groove to have my first chop, because usually I prefer direct chop in all my cases, unless otherwise indicated, like very soft cases and all, I go for stop and chop or flip and chop. So after making the first chop, I'm trying to divide the heminucleus into further smaller parts. Then after doing my complete chopping, then only I'll try to do the emulsification, because I prefer when the pieces are compact inside the capsular bag, I prefer the chopping, so that the pieces don't come out of the capsular bag and obstruct while the emulsification is done. So I'm just emulsifying. I'm just emulsifying it. As the iris is very flappy, you can see whenever I'm going just beneath the iris to catch hold of the piece that is trying to get incarcerated in the. So I am, see, with my this left dialer, I am just holding back the iris, then trying to bring out the piece to the center and emulsifying. Now the last piece is there. So whenever the iris was trying to, see, now it is trying to come to the center with my this dialer, I'm just holding it back. And I should not use a chopper at this place, because when I'm holding the iris like a hook, in that situation, because the fluidics is in this direction, so this part of the iris is becoming fluffy and trying to come out by the so I am done with the emulsification part. Now we will just slightly extend the main port and also the side port, so that we can do a clean bimanual irrigation and aspiration and proceed with the IOL implantation. So such cases, when the iris is really flappy, we have to be careful so that the iris doesn't come and stuck to the phaco tip. See, I'm just going below the iris, catching hold of the cortex at the periphery, not aspirating there, just dragging it to the center and then aspirating it out. So one part of the cortex is over. Now the other hemicircle, I'm just trying to aspirate out, clean out the cortical matter. As the iris is very fluffy, we need to be careful so that it doesn't pop out through the side port or main port. Little bit of cortical fibers are there. I'm just trying to aspirate it out. Now I'll inject the PCI well. If it is loaded properly, then directly it slips into the capsular bag. No need for us to even dilate. So now I'll just wash out the viscoelastic substance. Now we'll do the side port hydration or moxifloxacin. I did the side port hydration. So this completed our Phaco emulsification cataract surgery in case of a floppy iris. So such cases when the iris is flappy, we have to make sure the bottle height is a bit down, and whenever we are trying to do the emulsification part, when the fluidics is towards the iris, and that part of the iris will try to come and get stuck with the phaco tip. In such cases, what we do, we have to slightly hold the iris away from the phaco tip with the dialer, then try to emulsify the pieces.